Convalescent serum is essentially a blood product. And so when someone gets infected with COVID-19, their body makes an immune response. And part of that immune response in their blood, they make these proteins called antibodies. And these antibodies, we know, can help that person fight off the infection. And so the idea behind convalescent serum is if you can take the serum that has these antibodies from a patient who's been exposed, you can provide it as a blood product to someone who's sick. And those antibodies in that serum might help the person that's sick from the same virus get better. And so that's kind of the basic idea behind convalescent serum. Previous virus outbreaks or pandemics, people have been faced with the same question of, can you take the serum from someone who's recovered and potentially provide it to someone who's sick and see if they improve? So this was done with the influenza outbreak in 1918. This was done also with the original SARS epidemic in China back in 2002 and 2003. It was also done actually in the Ebola outbreak in Africa. And there's some data that convalescent serum may have helped some people. The laboratory here at University of Colorado Hospital and then research laboratories on the campus are collaborating to develop several different blood tests to test for these antibodies or the immune response to the virus. And so we're hoping with the collaboration between the research side and the clinical laboratories that we could have a serum test available for people hopefully in a short period of time. We're hoping weeks. But in order to be a donor, you have to have proof by a lab test showing that you were COVID-19 positive. And then the other requirement is that you have to be symptom-free for at least 14 days. If those two things are true, what we're recommending is that you contact a potential screening and donor site, and then there's a series of tests and questionnaires they have you fill out to ensure that you're actually capable of donating, and then you can go to a donor site and provide donor plasma. So there's several things that have made COVID-19 challenging to treat, and I think one of the things that's perhaps the most challenging is just how fast it's spread and emerged. If you look back over just a couple of months, how quickly this has become such a major medical problem across the entire world is astonishing, actually. And we have a really robust scientific and healthcare community that's ready to respond to these. But I think just the rapidity with which this emerged has just been incredible. And I think the response has been equally incredible, but it's just been very difficult to respond to such a fast-moving virus. And the other thing that's been difficult is it's really causing disease in wide swaths of the population. So it's affecting people really of all ages. And so, we have young people, relatively young people in the hospital. There's, clear data that it's more dangerous for older people. But it's making a lot of people that we usually wouldn't see in the hospital, making them sick. And so we're trying to understand those processes, and what's putting those people at risk is difficult, and what's putting them at risk for getting so ill. There's just a lot of unknowns in a very short period of time.